And if you want to expand on this system, just so you can see a bit clearer why, the shoulder has a big kind of impact on the neck and vice versa, we're just going to keep adding some of these muscles. So if we add the rhomboids as well here, because they connect into the scapula. So they are going to have an impact on the levator scapula. If these three muscles have the same origin or the same connection point, but at the same time they have different insertions, they're still kind of working together. When you shrug your shoulders together like this, it's the rhomboids that are creating the majority of that movement, but the levator scapula is also being involved. So whenever we have, neck pain, we also need to look down here, because you may have loads of these little trigger points around this tissue as well. Okay, so it's never just the neck, it's never just the shoulder, it's always both of them working together. Okay, and then let's continue expanding on that. Some of the other muscles that we're going to put into this system as well are the scalenes, and I have talked about the scalenes previously. They're really important muscles. You can see where they are. So if the levator scapula comes from the back, the SCM comes from the front, and the scalenes are coming from that lateral or the side, basically connecting into the area. Okay, and then again fade everything around. As you can see, the system is starting to expand and get bigger and bigger here, because we are adding other structures. But the moment we remove the traps, you saw like straight away how many other smaller systems and muscles we've got here. So that's what's so important, to essentially look past the traps, because they're the most common thing that people usually go to straight away. They try and release them, but the issue is usually a lot deeper. Okay, now with the scalenes, I've said this before as well, if there's tightness in the scalenes, then they will essentially move the shoulder up as well. They tend to pull on the entire rib cage. Okay, so it's really good to look at releasing them. There's a video in the course showing you how to do that. And if you tend to suffer with pain on the side of the neck, which is very common around here potentially, these are the muscles that you'll be looking at treating. Okay, so these are the 1, 2, 3, 4, 5. Because if we can count these as either separate or one muscle, so it can be either 4 or 5, doesn't matter. These will be the main muscles that you'll be looking at. Okay, so remember that the SCM, the scalenes, the levator scap, the rhomboids. Okay, so it's about releasing them, about making sure that these muscles are working the way they should be working. Okay, and once we've released them, that gives us the opportunity, or the window of opportunity, to essentially use corrective exercise to try and optimize the movement of the shoulder. Because if we essentially get the shoulder to move better, that's going to have a massive impact on the neck. Okay, so the next step will be to essentially work on the mobility of the shoulder. There are loads of mobility exercises in this course that you can check out. And what that's going to do, it's essentially going to allow all these muscles here to work better. And it's also going to allow all these bones to sit the way they should be sitting in the shoulder girdle. Okay, and this is why it's called a shoulder girdle, because it kind of, it's a combination of this joint here, which is the sternoclavicular joint, the acromioclavicular joint here, the scapulothoracic joints, and the glenohumeral joint here, okay? And all of these together help stabilize the neck, because as you can see, there's so many muscles that connect the scapula to the actual neck region, either the cervical vertebra or the actual skull. Okay, and that's why it's so important. You have a direct connection between, the shoulder and the bottom of the skull there. That's a key thing. That's really key. Okay, and that's what kind of proves the point that there's a big connection between shoulder pain and neck pain. And you need to kind of look beyond the trapezius, like we said previously. Forget about that, because it's not really, most of the time, it's not really the problem. It's usually these deeper structures that are causing the issue. So they need to be sorted out. And like I said, self-treatment or, treatment by a manual therapist, and then exercise, mobility, trying to mobilize the shoulder joint, because you need mobility here. If you don't have mobility in the shoulder, and if you're restricted with these movements, if I'm trying to put my arm behind my back and this happens, this is not just a shoulder issue, it's the neck that's also kind of being involved there. If I'm able to very freely place my arm behind my back like this, that means that my shoulder is working efficiently, my neck is not getting involved, and that is a great thing. When you're doing strength training, a lot of people tend to do a bench press or a shoulder press, and their shoulders come up, and that's straight away it's getting the neck involved, and the neck shouldn't really be involved in this exercise. The shoulder should be staying nice and low. Okay, so that's really important key points here for you to take away. And then when you're working on the stability of the joint, for example, the bear position is a great exercise, because it doesn't just get the shoulder in there, it also affects the neck, because you are holding a position against gravity where the neck is being targeted from that posterior aspect. For example, the side plank is a really really good way as well. Even though it's a core exercise, the neck is also being involved because you're essentially trying to stop it from tilting to one side. So you're isometrically contracting all these muscles. You know, they're like very easy exercises that can be done for you.